Thank you, Mr. President. I wanted to start tonight by just making a few remarks regarding what's ahead of us in the next few days, and that's the debate about a Supreme Court justice. I won't be able to cover everything tonight that I want to cover, but I'll just make some preliminary comments about healthcare, which has been the driving debate in this nomination, or at least the issue that has dominated the debate so far. We made, in my judgment, great progress in 2010 when the Patient Protection and Affordable Care Act was passed. Some refer to that statute as Obamacare, which isn't really the name of the statute and doesn't adequately describe what it's about. The patient protection part of the act, or the name of the statute, is the part I think that involves most Americans, all the coverages that are provided, all the protections, I should say, that are provided. One example of that, of course, is the protection for a pre-existing condition. The state of the law prior to that was if an insurance company did not want to cover someone because of a pre-existing condition, they had the authority to do that, or they could charge that person, they could cover the person but charge them more. That is no longer permitted, and in a state like Pennsylvania, that number, the number of people that are protected by that provision of the law because they have a pre-existing condition, that number is 5.5 million people. Nationally, it's as high as 135 million. So we know what's at stake in the debate, and it just so happens in this context that it's part of the debate about the Supreme Court nominee, Judge Barrett. I have a threshold initial concern that even before we get to the debate about the Affordable Care Act and what might happen to it, by virtue of the lawsuit file that is now before the court with an argument date on November the 10th. I think that's the primary reason for the rush of her nomination, so that she can be a member of the court for that argument on November the 10th to make that decision, which I think is highly likely to be a decision against upholding the constitutionality of the Patient Protection and Affordable Care Act. I have the threshold concern I have, though, is just the way this process has unfolded, not just more recently, but over time. The president, when he was a candidate, said he would choose from a list that was developed basically by two groups, the Federalist Society and the Heritage Foundation. They came up with a list, and that's the list he said he would choose from. That list was expanded when he became president. Judge Barrett was on that list, Justice Kavanaugh, Justice Gorsuch. You can see the pattern there. I don't want a Supreme Court that is chosen by those two groups, but that's what, so far, that's what the president has decided to do. In this case, the rush is, I think, for that basic reason, that the majority party here and Republicans in the House and a Republican president want this statute struck down. So they want to have that majority, a 6-3 majority, to do that. But I guess as much as I could talk, as we all do, about some of the policy, and I will, and the numbers, I think the most compelling part of this debate are the stories that come from people across Pennsylvania and across the country who have come to us. I met some of these families about 10 years ago. We were debating the act then, met them again when we were trying to stop the repeal in 2017 and 2018, and now we're getting together again because of this new and I think mortal threat to the law. I'll just mention two for tonight. Erin and Shannon. Erin, I know better. I've met her over the years. Erin Gabriel. She's been very public about the fight that she is waging on behalf of her 3 children with disabilities. Colin, Bridget, and Abby. I've heard a good bit about each of them and maybe the most about Abby. Erin is from Beaver County, Pennsylvania, right on the Ohio border, just north of Pittsburgh. And she's very concerned about what happens to her children because of their disabilities. Because, of course, under the old law, the old way of approaching these issues, a child with a disability could be denied coverage because of a pre-existing condition. And also a corresponding or related concern is the threat to Medicaid itself, especially in budget debates here over time, and also Medicaid expansion. So Aaron Gabriel is one of the people who has made it very clear to us the adverse impact on the life of her children that could result if the statute is overturned, declared unconstitutional. A second person who's brought her story to our attention is Shannon Streiner. Shannon is a mom to two daughters, Haley and Sienna. Haley's actually a second grader now. And Sienna is a young girl with Down syndrome. And obviously, Sienna is a child who is going to need a lot of care. And we've got to make sure that our healthcare system is there to meet the needs of those families. We're going to be talking more about these challenges that these families face. But for the life of me, I'll never be able to understand. If I lived 1,000 years, I'll never be able to understand why we would ever go backwards on healthcare. Why we'd go back to a time when a child or an adult who has a pre-existing condition would be denied coverage. Why we'd go back and erase, by virtue of a judicial, in this case, what would be a judicial fiat, erase all the progress that has been made because of the Affordable Care Act. So many more people with the security of healthcare. In my home state, it's 1 million people who gain coverage. The number now nationally is about 23 million. That number keeps going up. Most of them getting their healthcare through the expansion of Medicaid. The number on that keeps growing. Part of the reason it's growing is because people lost their insurance as a result of the adverse impact of COVID-19, people losing their jobs and turning to programs like Medicaid for coverage. So that number keeps going up. In the state of Pennsylvania, just by way of example, the latest number is 840,781 Pennsylvanians that have benefited from Medicaid expansion. And that's one of the reasons, the benefits of it is one of the reasons why you have states that are not controlled by Democrats that are voting to expand coverage. So that number keeps going up. And I want to make sure that we take every step necessary to protect coverage, not just to uphold a statute and to frankly grow the number of people with health care, but that we remember the impact it has on people's lives and ensure that the people who have gained coverage don't lose it. We have a state of, as the presiding officer knows, because of his family's roots, we have a state of a few big cities, but mostly it's a state of a lot of small towns. We have 48 rural counties out of 67. And in those small town or rural communities, we have a lot of people who gain coverage because of the expansion of Medicaid. As I said, you can see the number, 840,000 out of about 1 million who gain coverage through Medicaid expansion. So that's a big number. And even in a small county like Cameron County, one of our smallest, it might be the smallest population county, there's 350 people in that county that got Medicaid expansion. I want to make sure all 350 or more can benefit from Medicaid expansion. Big cities like Philadelphia have bigger numbers, obviously. when I look at my home county, Lackawanna County, and look at the next county next to it, the largest population county in the region, Luzerne County, these are huge numbers of people that have gained coverage on Medicaid expansion. In Lackawanna, it's more than 17,180 people. It's more than 26,000 in Luzerne County. Now, that's not covering, or that's not accounting for the folks who got coverage because of the exchanges that were set up. So the balance of those folks in Pennsylvania who got coverage between 840 and $1 million got their coverage because of the exchanges that were set up by the Affordable Care Act. One last point before I move to a second topic, Mr. President. Here's some of the benefits of Medicaid expansion that don't get a lot of attention, but that warrant attention. Just give you one example in 1 year from one state. 2019, Pennsylvania, over 135,000 people were able to receive treatment for substance use disorder because they were covered through Medicaid expansion. Now, most people may not think of that longer category or that long phrase, substance use disorder. The subcategory to that, and one of the largest parts of that challenge for many families, many communities, is the opioid crisis. And so that means tens of thousands of Pennsylvanians were getting covered by Medicaid expansion and treatment therefrom just at the time the opioid crisis was on the rise and just devastating, causing death and devastation to so many families, so many communities. So that's one benefit to the program that doesn't get a lot of attention. We know that on the larger question of the Affordable Care Act itself, beyond Medicaid expansion and the exchanges, is the so-called prescription drug donut hole, that coverage gap where the older Pennsylvanian at some point in their the availability of prescription medications has to pay for a while before they get into a catastrophic category where the federal government, the Medicare program, can pick up the cost. But in that coverage gap, and donut hole is a very benign way of describing a very burdensome problem for a lot of seniors. If that were to go away, if the Affordable Care Act were declared unconstitutional and that donut hole coverage or the filling of the gap, so to speak, were not there next year or the year after or 5 years or 10 years from now, that could adversely impact hundreds of thousands in Pennsylvania. By one estimate, more than 293,000 people on Medicare would be forced to pay more for their prescription drugs. So that's a lot on the line when it comes to the Affordable Care Act, and that's why not only is this nomination of such great consequence for one big issue, I think the Affordable Care Act Supreme Court decision will be the most significant decision that this court will decide maybe for 25 years because of the scope of the impact. Even someone who was not threatened directly by the loss of coverage or the loss of a protection for pre-existing condition, even someone who can buy because of their wealth or their circumstances, that person will also be affected because premiums will likely skyrocket. So there's very few, if any, Americans not affected by this lawsuit that will utterly destroy the Affordable Care Act.